What's up, veterans? VA Disability Guy here, and today's video you don't want to miss. We're going to talk about 5 lesser known VA disability claims that most veterans don't claim because either they don't know about them, they don't think they can claim them, but they're definitely worth claiming. But here's the kicker. If you suffer from all 5 of these, like a lot of veterans do, this could easily equate to 60%. So with that being said, if you like this content or you find it useful, leave a like on the video down below. And if you're not subscribed to the channel, subscribe to the channel and hit the notification bell so that whenever I upload videos like this one, you'll get a notification first. And I'm not going to hold you all anymore. Let's get straight into the content for today. All right, first on our list today is GERD, and GERD can be worth up to 10%. So for those of you that don't know what GERD is, I'm going to show you exactly what GERD is and what the VA is looking for specifically in order to give you 10% for it. All right, so gastroesophageal reflux disease, also known as GERD, occurs when stomach acid repeatedly flows back into the tube connecting your mouth and stomach. This backwash, called acid reflux, can irritate the lining of your esophagus. Many people experience acid reflux from time to time. However, when acid reflux happens repeatedly over time, it can cause GERD. Most people are able to manage this discomfort of GERD with lifestyle changes and medications. And though it's uncommon, some may need surgery to ease symptoms. So basically, GERD is caused by acid reflux. And let's look into the symptoms, and then let's look into what the VA is looking for to give you your 10% for it. Some of the common symptoms of GERD are a burning sensation in your chest, aka heartburn, usually after eating, which might be worse at night or while lying down. Backwash, regurgitation of food or sour liquid. Upper abdominal or chest pain, trouble swallowing, and sensation of a lump in your throat. If you have nighttime acid reflux, you might also experience an ongoing cough, inflammation of the vocal cords, or new or worsening asthma. So with GERD, you could get up to a 60% rating and as low as a 10% rating. So we're going to go from top to bottom. For 60%, the veteran must experience pain, vomiting, material weight loss, and hematemesis. I probably pronounced it wrong, but that's basically just vomiting blood, or melena, which is black stools from gastrointestinal bleeding. So in basically some kind of internal bleeding. And you also must have moderate anemia or other symptom combinations productive of severe impairment of health. All right, that's what you need for 60%, which is really bad. For 30%, the veteran must experience persistently recurring epigastric distress with dysphagia, which I probably pronounced wrong, but that is trouble swallowing. You also must have pyrosis, which is heartburn, and regurgitation accompanied by substernal or arm and shoulder pain, productive of considerable impairment of health. And for 10%, the veteran has 2 or more symptoms of the 30% rating that I just spoke about, but they're less severe. All right, now let's talk about varicose veins. And varicose veins can be worth up to 10%. So let's get into what they are and exactly what the VA is looking for to give you 10% for it. All right, so what are varicose veins? Varicose veins are twisted, enlarged veins. Any vein that is close to the skin surface can become varicose. Varicose veins most commonly affect the veins in the legs. That's where I have them. That's because standing and walking increases the pressure of the veins of the lower body. So all of you military members that are marching, that have been marching a lot, running a lot, standing at attention for long periods of times, odds are you may just have some varicose veins and you just didn't know it. All right, for many people, varicose veins and spider veins, a common mild variation of varicose veins, are simply a cosmetic concern. For other people, like myself, varicose veins can cause aching pain and discomfort. Sometimes varicose veins lead to more serious problems, and treatment might involve self-care measures or procedures done by a healthcare provider to close or remove the veins. Let's get to the symptoms. Veins that are dark purple or blue. Veins that appear twisted and bulging, often appearing like cords on the legs. When painful signs and symptoms of varicose veins occur, they might include an achy or heavy feeling in the legs, burning, throbbing, muscle cramping, and swelling in the lower legs, worsened pain after sitting or standing for a long time, itching around one or more of the veins, and changes in skin color around a varicose vein. So now that we know what they are and the symptoms, let's get into what the VA is looking for to give you 10% for them. When the VA is looking at your record for varicose veins, you'll get a 0% if you have asymptomatic, palpable, or visible varicose veins, meaning they're just there, but they don't cause you any pain or anything like that. And a 10% rating is warranted for intermittent edema, or basically just swelling, of extremity or aching and fatigue in the leg after prolonged standing or walking, with symptoms relieved by elevation or extremity or compression. Okay, ladies and gentlemen, we've gotten to the third disability that we're going to discuss in this video, and it is elbow strain. And it can be worth 20%. So let's see what exactly elbow strain is and what the VA is looking for in order to award you 20% for it. An elbow strain is an injury to the elbow that occurs when the muscles or tendons that flex and extend the elbow get stretched. An elbow strain may also be referred to as a pulled muscle. Funny, right? Elbow strain injuries are typically the result of the elbow moving beyond its limits, also known as overextending, which causes minor tears of one or more of the muscles and or tendons around the elbow. And here's the big deal. Listen to this. A strain differs from a sprain because a strain involves the muscle and or tendons, while a sprain involves the ligaments, also known as the connective tissue that connects one end of a bone to another to provide stabilization of a joint. So once again, health literacy, always a big deal, and that's actually what I talk about in this video above. Always use the correct terminology. If it's a strain, say it's a strain. If it's a sprain, say it's a sprain. Some of the symptoms of an elbow strain is pain, swelling, stiffness, and weakness. All right, y'all. So for elbow strain, it was actually hard for me to find the exact writing online. So I'm just going to show you all my documentation from the VA. So as usual, I will forego my HIPAA rights for your benefit. So, as you see, for the purpose of entitlement to Department of Veteran Affairs benefits, it is proposed to establish service connection for right dominant elbow sprain claimed as elbow strain bilateral, because I put in a claim for elbow strain. Looks like they probably gave me sprain instead, but either way, as directly related to military service with a 20% evaluation. Now let's see why they gave me 20%. Now this is why they gave me 20% for my elbow strain. Well, they gave me elbow sprain even though I claimed it as a strain, all right? So it says, we have assigned a 20% evaluation for your right, which is my dominant, elbow sprain, claimed as elbow strain bilateral, because I did put in a claim for both of my arms, my elbows, because flexing is limited to 71 of 90 degrees, meaning I could only flex my elbow 71 degrees. At that point, I felt pain. Additional symptoms include painful motion of the elbow. And they went on to say, the provisions of 38 CFR blah, 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 blah concerning functional loss due to pain, fatigue, weakness, or lack of endurance in coordination and flare-ups as cited in DeLuca versus Brown and Mitchell versus Shinsky have been considered and are not warranted. A higher evaluation of 30% is not warranted for limitation of flexing of the forearm unless the evidence shows, and this is what the criteria would need to be if you to get 30%. Flexing is limited to 56 to 70 degrees. So if your range of motion was between 56 and 70 degrees, then and you felt pain, that is when you would get the 30%. So this is why I was awarded 20%. All right, y'all, we're halfway through this video, and if you're still watching, thank you so much, and I hope this information is helping you, and if it is, leave a like on the video, and for those of you that aren't subscribed to the channel, subscribe. You won't regret it. So, number 4, ankle sprain. Very common, right? Yeah, and it can be worth 20%, but for those of you that don't know what an ankle sprain is, let me explain exactly what it is and what the VA is looking for in order to give you 20% for it. For those of you that don't know what a sprained ankle is, it's an injury that occurs when you roll, twist, or turn your ankle in an awkward way. This can stretch or tear the tough bands of tissue called your ligaments that help hold your ankle bones together. It's that simple. Now let's get to the symptoms and then we'll talk about what the VA looks for in order to give you 20% for it. The symptoms of a sprained ankle are pain, especially when you bear weight on the affected foot, tenderness when you touch the ankle, swelling, bruising, restricted range of motion, instability in the ankle, and a popping sensation or sound at the time of the injury. So this could get a little bit confusing. However, the highest VA disability rating for any ankle pain is going to be 20%. All right. That's unless it is secondary to another issue or they combine it with another issue. And when it comes to ankle pain, it can happen in 3 different ways. So it could happen through ankle instability, ankle tendonitis, or ankle arthritis. And in this situation here, where you're claiming ankle sprain, it would be ankle instability. But how does the VA rate ankle instability? When it comes to ankle instability, like I said, 0 to 20%. All right, 0% just means you don't got it. 10%, you feel a moderate limitation of motion. And for 20%, you feel a marked limitation of motion. All right, y'all have made it to the final disability that I'm talking about today, and it is carpal tunnel syndrome. For all of the clickety-clackers, the administrative folks, or actually non-administrative folks, because you can get carpal tunnel from a few things. So for those of you that may have carpal tunnel syndrome, it could be worth up to 20% as well. So let's get into exactly what it is and what the VA is looking for to give you 20% for it. Carpal tunnel syndrome is a common condition. Notice it's a common condition that causes numbness, tingling, and pain in the hand and forearm. The condition occurs when one of the major nerves to the hand, which is the median nerve, is squeezed or compressed as it travels through the wrist. In most patients, carpal tunnel syndrome gets worse over time. If untreated for too long, it can lead to permanent dysfunction of the hand, including loss of sensation in the fingers and weakness. I have that really bad. For this reason, it is important to diagnose and treat carpal tunnel syndrome promptly. And as I stated earlier, some of those symptoms are weakness, pain, fatigue, tingling, all of those things in your hands. When it comes to how the VA is going to rate carpal tunnel syndrome, it's going to be either based off it being bilateral or your dominant hand or non-dominant hand. Usually most people will get a bilateral rating. I got a bilateral 20% for mine, but this is exactly how they break it down. They want to look for if you have any kind of paralysis. If it's mild in your dominant hand, it'll be 10%. Non-dominant hand, 10%. If it's incomplete paralysis, If it's moderate in your dominant hand, it'll be 30%. For your non-dominant hand, 20%. Incomplete paralysis that's severe, dominant hand 50%, non-dominant hand 40%. And if you have complete paralysis in your dominant hand, that's going to be 70%. And in your non-dominant hand, it's going to be 60%. So that's what they're looking for when they look at your medical records. They're going to, for one, look for a diagnosis because, of course, you have to be diagnosed with carpal tunnel syndrome. And then they're going to look at how severely it impacts your life. Okay, you know the 5 disabilities, but remember how I said they could equate to 60%? I know what you're thinking. Dude, your math is way off. You told us 3 20 percenters and 2 10 percenters. That's 80%. Well, unfortunately, the VA does not do math the same way you and I, smart people, do math. And if you want to understand how the VA does math, check out this video that I have for you, and I'll give you a great explanation. And as always, thank you for watching. Like the video if you enjoyed the information I'm giving. Subscribe to the channel if you're not subscribed. Take care of yourself. Take care of those around you. And until next time, peace.